Until I found, the VAX-D treatment, I really had no comfort, and I didn't really know what direction to go down. And then once I got a few treatments of the VAX-D, I noticed, significant improvement with my bulging discs and just, back pain in general.
What you're looking at now is VAX-D therapy, a medically tested, clinically proven, non-surgical treatment for low back pain. VAX-D has treated thousands of patients with neck and low back pain without hospitalization, scarring, and all the other complications associated with surgery. The first nationwide study completed for VAX-D therapy showed 71% of all cases studied found relief from pain when treated with VAX-D. The results of this clinical study were so positive, news about the effectiveness of VAX-D therapy in eliminating low back pain was aired on more than 200 television programs across the country. Currently, VAX-D therapy is backed by 10 clinical studies and has earned the title Gold Standard in the non-surgical treatment of low back pain. VAX-D therapy is also highly effective in treating neck pain or pain deriving from issues in the cervical spine. In order to fully understand the many benefits of VAX-D therapy, one must first understand the relationship between the spine and pain.
The way the body functions is the weight has to get transferred from the upper part of your body all the way down to the ground. And how that works, it goes down from the spine, gets divided evenly to both hips, goes down to your knees, to your ankles, and all the way down. This pressure is built up from your body weight and the gravity, and that's something that's always going to be a constant. What happens in human anatomy sometimes is because this pressure gets built up as you go down in the body level, the lower part of the anatomy, or the lumbar area, what we call it, is an area that the human body is more susceptible to. That's why 90% of the population usually has lower back problem. Now these vertebrae, the reason they're all separate is what gives us the movement in our body. In order for us to move in any direction, we need these bones to be separated. Therefore, all these bones are individually separated from each other. And how they're separated by each other is by these things called discs. Discs are gelatinous substances that give cushion to the bones. So as the weight goes down, it has an area that gives it some sort of a bounce. Just like the gel that you see on the bottom of most running shoes now, when you jump up and down, you don't hit the ground as hard, but it gives you a nice little landing cushion. It's the same concept in the human body. Now these discs, what happens to them, because of the pressure from the bones, if the bones start moving in different direction, and if they're not transferring their weight properly all the way down, the pressure exerts more on one part of the disc as opposed to the other part of the disc. When one part gets more pressure than the other side, it causes the disc to bulge or to herniate.
Jumping, football, basketball, volleyball, sports in general, to, as we get older, car accidents, slips and falls, twists and torques and awkward motions can cause the material of the disc to actually bulge out. And if that material touches a nerve, it sends pain wherever that nerve goes. And as soon as that pain is there, you feel it. And it really causes a lot of discomfort in the area. But then your body also sort of freaks out and sends blood rushing to the area, which causes inflammation. And that can hurt even more. That's why a lot of patients get put on anti-inflammatories, is the hope is that if they can reduce the inflammation, then the patient will feel better because the swelling is down. But the problem is the disc, and it's still touching the nerve, and then you have pain. As soon as that nerve is touched, you have pain wherever that nerve goes.
Now what happens is when this disc bulges out or pushes out, it comes out and it comes in contact with the nerves that are coming out of the spinal cord. Spinal cord is what houses all the nerves in the body that gives you movement. So in order for you to move your arm, your brain has to make that decision. The information goes down through your spine, comes out to the nerves, and tells your body what to do. Then that nerve has to go back into your spine and go up to your brain so you know spatially where your body parts are and everything functions. When a disc is protruding out, it doesn't allow the full communication between your brain, the nervous system, and the nerve muscles to function properly. And how your body tells you that's not working is by pain.
The disc has no nerve endings in it, so that doesn't hurt. The problem with it is the proximity to your spinal cord and the nerve root. And so as soon as anything touches the spinal cord in any way, then you have pain wherever that nerve goes, the leg, the low back, neck, the arms, depending on its location.
What exactly is VAX-D therapy?
Well, VAX-D is a non-surgical procedure and non-invasive. Therefore, it helps conditions such as disc herniation, and it's probably the only documented machine that's been approved by FDA that actually helps bring the disc back into its position. There have been studies published in many different journals.
VAXD is a treatment designed to reduce the pressure level inside the discs and actually create a negative pressure. That negative pressure is actually able to draw the material that has bulged out, literally suck it back inside the disc so it's not touching the nerve anymore. So there are many decompression therapy treatments out there. And at this time, the only treatment that has FDA approval that it actually creates a negative pressure in the disc is VAXD. A lot of the other procedures use the same research, but the VAXD table was what was originally used in the research. And that's important because when we make a statement that we're creating negative pressure in the disc, it's important to actually do that because that's what makes a change, and that's what changes the disc material and heals the disc so that it doesn't continually happen to a patient.
How does VAXD therapy treat low back and neck pain?
VAXD is designed to create a strong enough negative pressure in the disc to actually draw nutrients from the surrounding tissue into the disc. And as we draw nutrients, we're actually able to rebuild the tissue and help it heal so that it will strengthen the wall of the disc and get that disc to be strong. Our body has an amazing ability to heal itself. You cut your hand, it fixes. You break your bones, they heal. The discs don't have that same healing ability because of the lack of blood supply. And what VAXD is able to do is by drawing nutrients into the tissue, you actually create a window where the healing process actually occurs and you can actually rebuild some tissue in the disc.
The two areas that are similar curves are the lumbar and the cervical area. Because of this anterior curvature on the cervical and the lumbar area, there's more pressure that gets to be sit on the anterior portion of the disc. This pressure on the anterior portion of the disc makes more likely for the disc to be pushed out backwards. So the disc has more likelihood of being posteriorly coming out. The disc most likely goes either backwards or sideways. It never goes anterior because there's a very thick ligament that holds everything in the front. But because the posterior part has to be open for the nerves to be able to go tell different parts of the body what to do, that's where the discs are allowed to be pushed out. So this pushing out of the disc happens in the cervical and in the lumbar area, and that's why VAXD is very successful in treating both the cervical and lumbar conditions.
Most patients on the VAXD table feel no discomfort at all. Most of them, it's actually so relaxing that they're able to fall asleep. I can actually make a personal statement to this as the fact that 10 years ago I was hit by a car and I had 3 herniated discs and I had pain all down my right leg, and I ended up doing VAXD and I did 20 treatments and I have been pain-free ever since. But each individual treatment didn't hurt at all.
How does VAXD therapy compare to surgery?
After surgery, you're down for a period of time, and then you have to get rehabilitation to get back to your normal daily activity. As opposed to VAXD, when you get your procedure, when you're out of our office, you can go back doing whatever you need to do, go back to your normal daily life.
Surgery is a very iffy thing, and people who go ahead with surgery are really, in effect, rolling the dice because there's so many variables involved with surgery, whereas this is non-invasive. So it sounded logical to me, and I took the treatment, and I started getting relief, I'd say, probably after the 3rd or 4th treatment.
I always feel so good when I got up. You know, just feel different somehow. After I finished the total treatment, I could tell the difference in a lot of things that I was doing, even in just the walking. It was nothing short of a miracle as far as I'm concerned.
I definitely do not believe I would be where I am today. I think that VAXD is probably the best treatment out there as far as lower back pain, in my opinion, and I would definitely recommend it to anybody.
If you experience the following symptoms, VAXD may help you find relief: constant ache in low back area, constant ache in neck area, stiffness in low back area, stiffness in neck area, painful or difficulty rotating head, arms, and hips, difficulty lifting legs, increased pain when walking or standing, pain or numbness that radiates from the lower back through the buttocks, numbness in fingers, pain in one or both buttocks, pain or numbness in the back of one or both legs, pain or numbness in one or both feet, radiating pain, burning sensations, tingling, numbness, or dull ache in lower extremities, radiating pain, burning sensations, tingling, numbness, or dull ache in shoulders or arms. If you or someone you know suffers from any of the symptoms listed above, VAXD could help. To learn more, call us. Don't let neck pain or low back pain ruin your life. Call us today